There may be times when an RFDS doctor requests that you give an injection using the equipment and medication from the RFDS medical chest. Although you may feel that these skills are beyond you, it is our intention that after viewing this video you will feel confident to safely give an intramuscular injection in emergency situations. This video demonstrates one method of giving an intramuscular injection. Techniques may vary between professionals, however the following principles remain constant. Write down the medication order as it is given by the doctor. Get a second person to check the name and number of the medication against your written order. Keep equipment as clean as possible once it is opened. Choose an appropriate site for the injection. Draw back on the plunger to check for blood before injecting the medication. Dispose of the needles and syringes safely, and always document the date and time the injection was given. In order to administer an intramuscular injection, you will need the following equipment from the RFDS medical chest: the appropriate size safety lock syringe, a 23 gauge Integra retracting needle, alcohol swabs, a yellow sharps container, and the medication as ordered by your doctor. In addition to these items, you will need the doctor's order you have written down, some tissues, and a container for the rubbish. The parts of the syringe referred to in this video are the tip, the barrel, and the plunger. The tip of the safety lock syringe has a screw thread that mates to the needle. The needle itself consists of a threaded hub and the metal shaft. The needle is packaged with a protective sheath, and for safety and hygiene reasons, this must not be removed before necessary. Before setting up the equipment, wash your hands thoroughly and wipe down the preparation area. When you spoke to the doctor, you would have recorded the name and number of the medication required. Select the medication from the medical chest and double check it against the doctor's order. You will need to check the name of the medication, the quantity of the medication in the ampule or vial, and the expiry date written or stamped on the container. Have a second person check that the medication you have selected is the same one the doctor has ordered. The second person must be able to read and understand English and can be the patient themselves. The medication for injection may come as a liquid in an ampule or as a powder in a vial, which must be dissolved in sterile water before use. Locate the peel sign on the syringe pack and open by peeling the backing paper from the clear plastic front. Expel any air from the syringe by depressing the plunger until it stops. Peel open the needle pack in the same way and screw the tip of the syringe onto the receiving hub of the needle. Place the prepared needle and syringe on a clean surface or back into the empty syringe pack. When using a glass ampule, ensure that all the contents are in the bottom chamber. This can be done by tapping or flicking the top of the vial with a fingernail. Grasp the ampule in the less favoured hand. Wrap a tissue around the top of the ampule and snap off the top with a sharp movement. Dispose of the ampule top in the sharps container. Place the ampule on a firm surface. Some glass vials will have a small red or blue dot above the neck, indicating the direction of breakage. Always hold these ampules so that you break away from the dot. For the plastic ampule, grasp the ampule in the less favoured hand. Grasp the top in the other hand and twist to break the seal. After opening, place the ampule on a firm surface. Grasp the syringe in the favoured hand and remove the needle cover, taking care not to touch the shaft of the needle. Hold the ampule at a slight angle in the less favoured hand. Carefully insert the needle with the syringe attached into the base of the ampule. Withdraw the plunger using the thumb and third finger to draw back, whilst anchoring the barrel with the index finger. When complete, dispose of the ampule in the sharps container. Some air will enter the syringe when you are drawing up the medication. Hold the syringe upright so that the air rises to the tip, and then expel the air by gently pushing on the plunger. If the quantity of medication is in excess to what has been ordered, carefully depress the plunger to expel the additional quantity of medication. Have your second person check the amount of medication in the syringe and confirm that it is the quantity the doctor has ordered. If you encounter any difficulties with the preparation and checking of the medication, please discuss this with the doctor who has ordered the injection before you proceed. The preparation procedure for medication in a vial will be discussed later in this presentation. Have the patient sitting or lying down, and expose the outer part of the patient's thigh. If the patient has a leg injury, use the thigh of the uninjured limb. The site to be used is slightly above halfway between the knee and the top of the thigh. Remove an alcohol swab from the packaging and swab over the injection site. Hold the syringe firmly in your dominant hand and stretch the skin of the thigh with your free hand. Using a dart-like action, insert the needle into the thigh at an angle of approximately 90 degrees until 2/3 of the needle is inserted. Now with your free hand, grab the hub of the needle at the point where it connects with the syringe and hold firmly. The aim of this action is to support the syringe whilst giving the medication. Whilst firmly supporting the needle and syringe, gently pull back the plunger approximately 2 mm. If blood is seen in the barrel of the syringe, it means that the tip of the needle is resting in a blood vessel rather than the muscle tissue. Withdraw the needle slightly and pull back on the plunger again. If blood continues to be drawn into the syringe, fully withdraw the needle and start again in a slightly different position. There is no need to discard this medication if it is used immediately. If no blood is seen in the syringe, slowly depress the plunger until all of the prescribed medication has been instilled into the muscle. Once all the medication has been dispensed, continue to depress the plunger until 2 firm clicks are felt, and then begin to withdraw the needle. This action automatically retracts the needle back into the syringe barrel, greatly reducing the risk of a needle stick injury. Dispose of the used syringe unit into the sharps container. Record the time the injection was given onto the paper that contains the doctor's order. Ensure a copy of this information is given to the flight nurse or other appropriate medical personnel. The sharps container can also be given to the RFDS for safe disposal. Remember these steps when giving an intramuscular injection. Check the medication against the doctor's orders and ask another person to verify that it is correct. Open the syringe and needle packets. Prepare the ampule. Draw up the medication and verify that the dose is correct with another person. Insert the needle into the thigh using a dart-like motion. Draw back slightly on the syringe plunger to check that the needle is not in a blood vessel. Give the injection. Dispose of the used syringe unit into the sharps container and record the time the injection was given onto the doctor's orders. The skills demonstrated previously will be required for the preparation of a vial. As with an ampule, you will need the appropriate size safety lock syringe, a 23 gauge Integra retracting needle, alcohol swabs, a yellow sharps container, and the medication as ordered by your doctor. In this case, powder in a vial and sterile water in a glass or plastic ampule. In addition to these items, you will need the doctor's order you have written down, some tissues, and a waste container. Remove the protective cap from the vial. Do not use the medication if the cap is missing. Clean the rubber stopper on the top of the vial with an alcohol swab, and leaving the swab on the top of the vial, place it on a firm surface. Attach the screw-on needle onto the syringe and draw up the water for the injection as directed by the doctor. Expel the air and any excess water. Now insert the needle through the centre of the rubber stopper of the vial and inject in the water. With the needle end above the level of the solution, remove your thumb from the top of the plunger. The plunger will rise up as air enters the syringe. Now grasp both the syringe and needle in your favoured hand and shake well to dissolve the medication. With the needle tip under the solution, inject the air from the syringe back into the vial. Remove your thumb and allow the plunger to rise. Now invert the vial and withdraw the required amount of solution. To empty the vial completely, withdraw the needle to just inside the rubber stopper and continue to withdraw the plunger. If the amount in the syringe is more than what was ordered, carefully expel the excess. Remember, only use medication from the medical chest when requested to do so by the RFDS doctor. It is important that your medical chest is kept up to date and is stored safely. If you have any questions relating to giving an intramuscular injection that have not been addressed in this video, please do not hesitate to contact your nearest RFDS base.